A typical dental office has one of two ways of resupplying and restocking their materials. The most common way is to have every operatory fully equipped with cabinetry and drawers. These type of practices have room-centric resupply and restocking systems. This is when you have every operatory fully equipped with an overload of instruments and maybe some of the supplies you need for everyday procedures. This can really feel overwhelming to your patients, but also cause a chaotic day for your staff. The second most typical way that dental offices resupply and restock their inventory is to have operatories designated for certain procedures. These type of practices will have operatories designated for hygiene only, endo only, or surgery. This can really become a bottleneck when trying to schedule, but also you're not maximizing your operatory production. When you have a clear, precise system for setup and resupply, your appointments will run more smoothly. Your supply costs will decrease, but your staff performance will increase because of the decrease in stress and the time saved. The objective here is to eliminate the glorified kitchen cabinetry and drawers and to really utilize the office's space and maximum mobility to flow more efficiently. The typical cabinetry is about 8 to 10 feet high. Unfortunately, dental assistants are not that tall. To really pull down and utilize that space that is normally unreachable can really help when trying to centralize your stock and resupply. Most of the time, cabinets and drawers are unorganized and overstocked. These are the cabinets and drawers we clean out once a year, and we find that one missing item. That was the item that we had 3 staff members looking for that one particular procedure that the doctor does one time a year, and we never found it. Meanwhile, the doctor's sitting in the operatory, looking at the patient, pretending like the appointment's flowing the way it should. This is why having everything visually stocked is important. The second step is to make everything visual and accessible. It is true what they say, if it's out of sight, it's out of mind. All supplies should be out of their original boxes. You'll be surprised how much room you actually get after removing the packaging. This process is what lean manufacturers use. It's called visual restocking. Dental offices have a large amount of supplies that are needed, so a simple supply control is even more vital than it is for manufacturers. Next, items should have their own labeled space within a logical restocking order. Next, items should have their own labeled space and a logical restocking area. For example, impression trays are near the impression materials. This allows an efficient flow when coming into central stock area to set up for a procedure. As I mentioned earlier, you will not need to come to the central stock area for all items for every procedure. You need to determine what you use 85 to 90% of the time and stock that in a room. We have ways of doing this. As I mentioned previously, 85 to 90% of your most commonly used materials should be in every operatory. Most offices can fit their most commonly used restorative materials, their adhesives, and retraction materials into a tub. Your disposables can fit into a consumable tub. You should have about a week's worth in every operatory. The other 10 to 15% of the materials used can be mobilized and put into specialty procedure tubs. These type of procedures, most commonly used, could be endo. You have specialized equipment that is quite costly and a bunch of materials to do one endo procedure. You can mobilize this onto one mobilization cart. Specialized mobile carts should be located right outside the operatories. These carts are fully equipped for everything you need for that specialty procedure. All of the equipment and the materials. This rapid cart can easily be deployed off to an operatory and easily set up. Tubs and mobile carts can be easily brought into central stock area to be restocked. If you are watching this, you have the desire to grow and grow new staff members. In order to grow and have control over your inventory, schedule, and patient care, you must have simple systems and checklists for procedure setup, breakdown, and inventory resupply. Your patients will notice that you're more organized, and your team will feel more energized. And you will have the ability to maximize your space and schedule.